Mm, okay, so I'll not waste a lot of time. Let's get into it as more people get coming in. So good afternoon, everyone, and welcome to today's Lunch and Learn session on health impact assessments. My name is Sonakshi, and I am the Senior Public Health Officer here at the Built in Natural Environment team. Alongside me, I have Alva, who is an interim Senior Public Health Officer, and she'll also be helping me with the presentation in the second half. We also have Venika, who is a support officer in our team, and she'll be helping us as a slide keeper and help us roll over the slides today. Before we get started, we have a few housekeeping points to cover. The session would be recorded, so this ensures that you can always come back to the content later if needed. And we encourage participation throughout the session. So if you have any questions or comments, please feel free to use the chat function. We'll address them later or during the presentation as deemed appropriate. A copy of the presentation, of course, would be shared throughout the session, so you will have access to the materials we discussed today. So here's what we'll cover in the session today. We'll start with an overview of what HIA is and why it is an important tool in public health and planning. We'll break down this.
Tanashki, sorry,
Sorry.
just say, could everyone just make sure they're on mute, please?
Yeah.
Sorry, I'm just
I
hearing
would.
some backgrounds. Yeah.
Yeah, I would request everyone to please be on mute. Yeah, is that fine now?
So now the recording.
Yeah, I'm recording. I'm recording. Am I audible? Okay, let's go. So here's what we'll cover in the session today. We'll start with an overview of what HIA is and why it's an important tool in public health and planning. We'll break down the steps involved in conducting the HIA, and we'll also discuss how HIA is applied in real-world scenarios to ensure better health outcomes. Lastly, we'll engage in a practical exercise where you can try out the HIA process. This session aligns with the public health skills and knowledge framework, focusing on the 4.1 and 5.2 points. Okay, with the moving forward, HIA, Health Impact Assessment and Planning, complements the governance teamwork and overseeing the quality impact assessment processes for new policies, strategies, and projects across the council. Going through the definition, so what exactly is HIA? HIA is a structured process that evaluates the potential health impacts of a policy or a program or project while it's still being assessed or planned. This involves looking at both the positive as well as the negative health outcomes of the population, providing a comprehensive understanding of how a project might influence public health. It's not just a theoretical exercise, it's designed to inform decision makers early before any policies or projects are implemented. This proactive approach allows us to take actions that maximizes the positive health outcomes and minimizes the negative risks or impacts. According to the International Association for Impact Assessment, HIA systematically judges the potential and sometimes unintended ones effects of a project, policy, or a program on the health. It considers how these effects are distributed across different populations, ensuring that vulnerable groups are protected. Now let's move to the purpose of HIA. Purpose of HIA is to integrate health considerations into decision making at the earliest possible stage. By raising awareness about potential health impacts, we can ensure that health improvement becomes a part of the decision making process and not remains just as an afterthought. A key goal of HIA is to ensure that it involves health equity. This means making sure that vulnerable populations benefit from the policies while minimizing the negative health outcomes for those who are most at risk. It helps identify who will be affected, how they will be affected, and ensures that health disparities are reduced. It takes a broader approach to health, considering not only the immediate health outcomes, but also the social determinants of health, like employment, education, access to healthcare, and environmental conditions. Now, let's take a look at key benefits that HIA provides. It improves health and reduces inequalities and ensures that projects or policies do not unintentionally harm health or perpetuate any inequalities. By focusing on vulnerable group, it guarantees that health equity is prioritized. It focuses on population health. It's particularly useful in assessing whether vulnerable groups are disproportionately affected, helping to ensure equitable outcomes. It involves public engagement, that is the one of the critical aspects of HIA, that it's structured method for involving the public. It means engaging with those who will be directly affected by a proposal. Their concerns, needs, perspectives all are integrated into decision making, ensuring that decisions are grounded in community input. Obviously, it leads to informed decision making. This allows for identification of any alternatives that can prevent any risks and promote overall health. It proactively identifies any key benefit of HIA is its ability to benefit the unintended consequences before its implementation. So it allows for adjustments and recommendations to mitigate risks and ensure that health outcomes are positive. Plays a crucial role in creating health promoting environments because that's the goal. It provides guidance to ensure that policies, programs, or any projects contribute to overall health and well being instead of just undermining them. So, this is where HI's positive approach comes into play, that it not only just seeks to prevent negative health outcomes, but it also looks for opportunities to maximize any positive health impacts. Um, by incorporating health at the heart of planning, and policy making, HIA helps to create environments that enhance health for all, particularly for the most vulnerable. And moreover, HIA supports evidence based policy making, ensuring that decisions are grounded in robust data and comprehensive analysis. This minimizes the chance of assumptions or biases influencing the decision making process. Moving on to the next slide, let's discuss the relevance of HIA in public health and planning. So it's deeply relevant to both public health and urban planning because it offers a multidisciplinary approach, engages various stakeholders, including the public, urban planners, health professionals, and policymakers. So this inclusive approach ensures that decisions reflect a wide range of perspectives and experiences. It combines both the qualitative and the quantitative data to provide a well rounded understanding of potential impacts. One of the core strengths of HIA is its focus on health inequalities during a planning process. For example, it examines how new infrastructure, such as transportation systems or housing, may disproportionately affect certain populations like low income groups or communities with limited access to healthcare. HIA also takes the broader definition of health because it considers factors like social determinants, income, education, social support, and the environment. So these factors all influence health outcomes and must be considered when evaluating policies and projects. Now, let's take a closer look at the key features that define health impact assessment. It involves various stakeholders, uses diverse methods, including community input, to ensure that decisions reflect the concerns and needs for all the affected groups. It is highly evidence based, uses quantitative, qualitative data drawing from studies, research, and public health to inform decisions. Focus is on health inequalities because obviously we are ensuring that vulnerable groups such as the low income groups maximize health benefits and the marginalized communities are not neglected. It thrives on recommendations for improvement because it provides actionable recommendations to maximize health benefits, ensuring that interventions always lead to positive outcomes. It focuses on the broad definition of health, as I have mentioned earlier. Now, let's move on to social determinants of health. These are actually the factors that have a profound impact on an individual's or population's health and well being. It considers a wide range of these factors to ensure that the health impacts of policies, projects, and plans are fully evaluated. So they are broadly classified into four categories. The first one revolves around the social, cultural, and economic environment. It includes factors like employment, social networks, people beliefs, and access to essential services like healthcare and education. So these influence uh, These influence health outcomes. For example, people with secure employment and strong social networks, they tend to have better health outcomes. Next sphere is physical environment. This is where we come in as a team from built a natural environment in which we ensure that all the equities, drinking water, safe access to sanitation, public spaces, housing, planning, all of this is taken into account. uh, the third sphere is institutional elements. Now, this refers to any authority, government body, or NGOs that influence health, such as healthcare systems, regulatory bodies, and social support networks. Their ability to provide services and maintain health standards plays a crucial role in improving or compromising any health outcomes. The last but not the least is individual traits and actions. Now, these are the factors such as age, gender, state of health, personal habits like diet, hygiene, exercise. All these significantly affect health. For example, certain chronic diseases are influenced by genetics, but lifestyle choices like physical activity, nutrition, and smoking are just as important. So, HI focuses on these social determinants to assess the broader health aspects of any policy or project, ensuring that the health impacts are understood from all angles and that vulnerable groups are specially considered. This broad holistic approach helps inform decisions that reduce health inequalities and promote healthier and more equitable environments for all. Moving on, let's take a breakdown of the steps involved in the HIA process. So it's a six-step process, and the first key step is screening. We have to determine whether an HIA is needed for the given proposal. Involves assessing whether a project or a policy could have significant health impacts that require further evaluation. The next phase is scoping, where we define which health impacts needs to be considered and we identify the stakeholders who need to be involved in the assessment process. Third step is the evaluation of potential impacts of the proposal of health on health, focusing on the population groups that may mostly be affected. Based on the assessment, we make the recommendations to maximize the positive health benefits and minimize any potential risks or negative effects that could come into play. This reporting step, the fifth step, involves sharing the results and recommendations from the HIA with the decision makers, ensuring transparency and accountability. Monitoring and evaluation is the final step that measures how HIA is effectively monitored. This includes assessing the impact of the HIA on the proposal and evaluates the health outcomes of any changes made based on the recommendations. The next slide talks about the types of HIA. So mainly there are three types of HIA that are followed in UK. The first one, desktop HIA, is the healthy placemaking checklist. So it takes a couple of hours or it's completed in a day because it draws on existing knowledge and evidence and uses checklists to provide a broad overview of potential health impacts. The next one is rapid HIA. It can be completed quickly, but it is suitable for smaller projects or when time and resources are limited, and it also drives on existing data. For example, smaller residential developments or infrastructure projects with lower health impacts may use a rapid HIA. The comprehensive one, on the other hand, as the name implies, it's a more detailed research work and involves primary data collection. This is the type of HIA that is used for large scale projects in urban developments or any other major transportation infrastructural projects. On the next slide, we have an example of HIA checklist, or what we call as Hoodoo checklist. It's Healthy Urban Development Unit checklist. It ensures that all the relevant health impacts are considered during the planning and the development process. Birmingham is currently working on a placemaking checklist based on this Hoodoo model, and it evaluates the projects that ensures health concerns are identified early on and addressed in the planning phase. It includes question about environmental impact, social factors, and potential health risks that need to be mitigated. So, in conclusion, health impact assessment is a vital tool that ensures health is integrated into planning and policy decisions. By evaluating potential health impacts early in the decision-making process, HIA helps to ensure that policies and projects lead to better health outcomes and avoid any unintentional harm. It's not only about preventing negative impacts, but also about identifying positive health opportunities to maximize the benefits for all. So before we move on to the application of HIA, I would invite my colleague Alva to carry on the presentation forward. Over to you, Alva.
Thank you, Sunakshi. Hi, everyone. I'm Alva Kazunis. I'm the Interim Senior Public Health Officer for the Built and Natural Environment team. I hope you're all keeping well today and enjoying the presentation so far. We're now going to very briefly explore 5 real-world examples of how HIA has been applied to create healthier environments and improve health outcomes. I won't go through every example on this slide, but I've listed them to demonstrate the wide range of policies and projects where HIA has made an impact. I've also included links for anyone interested in exploring these examples further. So the first one is a HIA of a local plan. I'm guessing most of you will know what a local plan is, but just in case, a local plan is a key document through which local planning authorities can set out a vision and framework for the future development of an area. It's central to the planning system and is the main consideration in deciding planning applications. From a public health perspective, influencing the local plan is particularly significant, and HIA can help ensure health and well-being is embedded throughout the policies within the local plan. And there's been a lot of examples of HIA on local plans, and I've just listed one here, which is from Leicester. So in their assessment, one of the key recommendations that they identified was the need to make it explicit and to help, it was to make explicit reference to and limit further creation of the obesogenic environment and actively consider this in design planning. It highlighted that part of reducing the obesogenic environment is making healthy behaviour an easier option, or in other words, making the healthy choice the easy choice. As a consequence, Leicester's new local plan now has 2 policies related to health. One of the policies is a healthy and active city, which clearly states the city council's commitment to reducing health inequalities, increasing life expectancy, improving quality of life, and encouraging physical activity. And a second policy specific to health impact assessment. Another example of a policy that benefited from a HIA was the London Low Emission Zone, also known as LES. First, to say that the LES scheme isn't a planning policy, but it is closely related to planning issues and most obviously the transportation. This HIA was conducted in 2006 when London had the worst air pollution in the UK and amongst the worst in Europe. At the time, it was estimated that there were 1,000 premature deaths and a further 1,000 hospital admissions annually due to air quality from all causes. The low emission zone was proposed to improve air quality by encouraging the most polluting heavy diesel vehicles driving in London to become cleaner. A HIA was conducted and the main recommendation was for TfL to further develop the methodology for assessing air quality benefits before implementing the scheme. This recommendation was applied and there's a report, a very detailed report on TfL's website that explains how the impacts of LES in London are being monitored and assessed. At a project level, HIA can be conducted on large-scale developments like entirely new towns or small-scale developments like 50 residential units. So, for example, Northstowe is a new town in Cambridgeshire, and it was part of NHS England's Healthy New Towns programme, which worked with 10 demonstrator sites across England to explore how new developments could create healthier, more connected communities with integrated and high-quality services. The HIA recommended ensuring formal open spaces were accessible to all user groups, including those with disabilities and the elderly. The project successfully incorporated health promoting design principles such as walkable neighbourhoods, community cohesion, and access to health services. An example of a smaller scale development is a housing project for older adults consisting of just 39 dwellings on a site with pre-existing accommodation for older people. Resident engagement highlighted the health benefits of a non-smoking environment within the communal areas. However, discussions with residents around designated smoking areas raised concerns about potential litter and maintenance costs. So one of the recommendations in this instance was to think about and plan for a designated outside smoking area before handover to residents rather than addressing the issue reactively. And finally, we'll look at one example from Birmingham. The Langley Sustainable Urban Extension is a development of approximately 6,000 homes. A supplementary planning document was produced for this development and a HIA was conducted on this draft SPD. The aim was to show how the Langley SPD addresses health and well-being and identify sections where it could be strengthened. The HIA identified areas for improvement, such as clarifying the long-term ownership and management of the green spaces, reiterating pedestrian priority on streets, and enhancing walking and cycling links to local employment opportunities by addressing severance caused by the A38. These improvements have largely been addressed in the adopted SPD. So hopefully these examples show the flexibility of the HIA approach, its relevance addressing the needs of local populations, and its ability to tackle diverse health and well-being themes. So we're now going to move on to the final section of the Lunch and Learn. We're going to engage in a hands-on activity to practice conducting a HIA, which will help you apply what we've discussed over the past 20 minutes. So here's a scenario. A council is planning to convert an abandoned industrial site into a public park, including amenities such as a playground and picnic area. Your task is to analyse this proposal by considering first the potential positive health impacts, then the potential negative impacts. We'll then look at the potential population groups who are most likely to be affected. And finally, we'll think about some recommendations to maximise benefits while minimising the risks. So please put your answers in the chat function, or if you'd like to unmute to share your thoughts, please feel free to do so. So the first question is, what are the potential positive health impacts of converting this abandoned industrial site into a public park? Better mental health? Yeah, definitely. If we think of the picnic benches, good for the environment, absolutely. Reduction in risk of exposure to contaminated land, definitely if done properly. Better connectivity between green spaces, absolutely. Contamination, improved physical activity for all, increasing, yeah, clean air, reduced risk of pests, pollutants, yeah. Better air quality. If we think of some of the population groups who might be using it, so let's think about younger children in particular, how might they benefit? Community cohesion, opportunities for spaces to increase community noxious gases, reducing the urban heat island effect. Very good. Absolutely. And particularly, obviously, in urban areas. Increase wildlife, therefore, more to engage with, learn 5 ways to well-being. Absolutely. Playgrounds, activity, green spaces. Brilliant. Okay, can we move on to the next slide? Monica, please. So yeah, I think you've captured everything here. Yeah, you absolutely have. So that's great. We're going to move on to the next question. So what are the potential negative health impacts of converting an abandoned industrial site into a public park? Meanwhile, construction, yeah. A risk exposure to community members who use the park, yeah. Litter, if not managed well, yeah. Ensuring any contaminants and pollutants are properly disposed of, absolutely. That'll be the most critical one. If not done properly, potential exposure to contaminated land, yeah. Okay, Monica, I think most of them have been covered. Will you move on to the next slide, please? So yeah, it's around possible exposure to soil contamination, increased noise pollution, actually, which we didn't cover, and potential safety concerns if the park is not well designed or maintained. And I think this is a particularly important one. So it's not just safety concerns, but it's also about like who gets to use the park based on how it's designed. And maybe we can kind of think about that more during question 4 when we're looking at maximizing health benefits and reducing risks. Okay, let's move on to the third question. So the third question is, which population groups are most likely to be affected by this new park? Local residents, yeah. Families. Young people, definitely. People who take a lunch break close by. So workers, yeah, definitely. Those with access to cars or who are more mobile. People with disabilities, older people, yeah. I think we've probably covered most of the groups. I'm assuming with young people, we're also including young children there, children and young children. Could be a new shortcut to public transport links for people to get to shops and work. Yeah. So that's a benefit of it. Dog walkers, absolutely. Okay, let's move on to the next slide, which I think we've covered everything. Yeah, local residents, children and families, elderly, people with limited access to green space, actually, which is a really important one from a public health perspective, because we know there's a huge evidence base now describing or providing the evidence for why it's important to have access to green space and the negative impacts if you don't. Those with health conditions that could benefit from outdoor activity. Okay, so we'll go on to the fourth question. And how can we maximize health benefits and reduce the risks associated with this scenario? So there's lots that can go into this. So if we think first about maximizing health benefits. So getting groups set up in the park, absolutely. Yeah, so activating the park, yeah. Making sure it's properly maintained, really, really important one. Good lighting, paths, signs, absolutely critical for safety and for people with different mobility issues. Inclusive engagement with groups of people likely to be affected in the first place. Absolutely, really, really important one. So we need to be engaging the communities. Sorry about that. We need to be engaging people, the local communities. Look at evidence of other impacts of developments. Yeah. Cleanliness. Yeah, that links into the maintenance. Roxana, development of park layout is with the community. Would you be happy to maybe elaborate on that one a little bit more? If you want to unmute, no worries if you don't, but it'd be good to...
Just like taking a bit of a co-designed approach, so working with groups that all the people that we think might benefit from it, like the children, like perhaps young, like parents with early years, like with babies who might be using it, like people who might have different abilities, like looking at any like level changes and things like that, and how, you know, how people might want to use that park. Like if there is a couple of bus stops that it makes it a shortcut, like mapping that out so that the paths allow that. Looking at any safety issues of like clustering of people in the area and whether there could be more kind of proactive spaces for those young people or older people, whoever they might be. Yeah, just because just it helps, like if once you work with the community to map those things out, it could help inform the plan so it's more, so it does maximise those health benefits and reduce kind of safety or concerns, etc.
Yeah, really, really important. And there's another really important group to consider as well. And there's been a lot of work over the past couple of years to kind of raise awareness, and that's actually young girls in particular, because there's been research that a lot of these the MUGAs, what does MUGA stand for? Multi-use game areas, that they're designed with boys in mind, and it's something like 80 to 90% of the MUGAs are being used by 80 to 90% of the people using it are boys. So it just kind of demonstrates how like the design of the play areas within the parks, it's really important to kind of consider all the different groups, and not just boys. So, you know, putting in basketball courts and skate parks, as great as they are, actually is everyone getting to access them? Okay, so should we start thinking about some of the ways to reduce risk? Monica, if you go back, please. Yeah, thank you. So ensure the site is properly examined for chemical deposits to determine if the benefits outweigh the risk. Collaborate with partners like the police. Yeah. Yeah, checking the soil. Yeah. Yes, local ownership. Yeah, that's an important one. Okay, we can move on to the next slide. Lots of great input there. So I'm guessing you've covered pretty much everything. So conduct thorough environmental assessment and soil remediation. That's been covered. Design inclusive spaces for various ages and abilities. Install proper lighting and security measures. Yeah, we've agreed on all that. Include walking and cycling paths, which seems like a very obvious one. Create a mix of active and passive recreation areas. Design communal spaces like picnic and seating areas, which is really important in terms of inclusive design. Place noise dampening vegetation between the park and nearby homes to reduce sound. So again, we've missed out on the issue around noise pollution. Involve the community in planning and design processes and implement a maintenance and programming plan. So I think you covered all of those with the exception of 1 to 2. So excellent work. So can we go on to the next slide? So just before we finish up or take some questions if you have any questions, here are a list of really excellent resources and tools if you want to learn more about HIA. If you want to do more e-learning, there's a really good course, free module, sorry, with the Wales Health Impact Assessment Support Unit and also with the Institute of Public Health for the Island of Ireland. So yeah, you can just go onto their websites, or the links are there anyway. And yeah, so thank you for joining our Lunch and Learn. Hopefully you've learned something about health impact assessment and you've found it useful.